I'm Dr. Supriyo Pramanik, consultant physician practicing in Kharagpur and around Kharagpur for last 22 years almost. And I've been practicing medicine. And today's topic of discussion is esophageal stricture, how to spot them and find relief. Now, the esophageal stricture is the narrowing of the esophagus, the food pipe, the pipe which carries the oral cavity to your stomach and carrying the food particles and the fluid, that is the water and other liquid also, into the stomach is called esophagus. And this narrowing of this food pipe is called esophageal stricture. So it makes the food pass through with difficulty or it obstructs the passage of the food. So the most common cause of esophageal stricture is the long-term GERD, that is gastroesophageal reflux disease, where the stomach acid rebounds into the esophagus repeatedly for a longer period of time. It irritates the esophagus and causing injury to the esophagus. It is swelling as well as narrowing and even scarring over time. And the other causes like other injuries or maybe other scarring or other operations can cause esophageal stricture also. So in some allergen can cause esophageal stricture, and apart from that, certain harmful chemical ingestion or harmful substance ingestion or maybe radiation therapy or maybe due to the cancer, maybe due to the surgery and certain rare skin diseases like the scleroderma, this can cause esophageal stricture. And some people are born with esophageal stricture, that is a congenital stricture. And some rare cases, the pressure from the outside can cause esophagus to become narrow. So main symptoms of esophageal stricture is the difficulty in swallowing, that is known as dysphagia. That is, you might feel that food is not going through the food pipe or esophagus properly. You might feel a little bit of stickiness, or maybe the food is going slowly through your throat, your chest and your upper stomach or upper abdomen. And you may find certain symptoms of esophageal sphincter like that, or you may be asymptomatic as well. That is, you may not feel any kind of symptom. But when the symptoms are present, with the worsening of the stricture, your symptoms will get worse also, or you feel the symptoms more. At first, the symptoms of esophageal stricture is that the main difficulty is, with the solid foods. You can feel the problem with the ingestion of the solid food and your medicines or pills specifically. And gradually, as the stricture progresses, you will gradually feel difficulty in swallowing the liquid itself. And the other symptoms of esophageal stricture are the heartburn or maybe regurgitation. That is the coming back of the food particles, especially the water and the other fluids, back into the throat or your mouth cavity after eating. Or maybe you may feel pain while swallowing, that is dysphagia, or may eventually you feel weight loss also. And the esophageal sphincter is usually diagnosed by the gastroenterologist. They will understand your symptom, they will take a medical history, and depending on that, they will do some tests to confirm the diagnosis. And after that, they will start the treatment for that. And the first test for the esophagus stricture detection is the esophagogram or the barium swallow, where you will be given a stocky substance like is barium, and you are made to swallow that, and you put on the X-ray machine under live video. The serial X-ray will detect how the barium is going down, and it will detect whether there is any kind of stricture or narrowing in the esophagus. And the second test, which is most commonly used nowadays, the upper GI endoscopy, where you will be put under local anesthesia or maybe sedated also by your doctor. And your doctor will put a thin flexible endoscope or thin pipe through your throat inside your food pipe to the stomach. And a camera is being mounted on this pipe, and your doctor will see what is being happening inside and what has happened. And at times, if it is required, doctor may take sample of small tissues from inside to confirm the diagnosis of this stricture or maybe the cause of the diagnosis, especially if it is cancer or due to some growth only. And the thing is that the treatment of esophageal stricture is mainly aimed at dilating the opening of the esophagus so that you can swallow the food easily. The dilating the esophagus is called the esophageal dilatation. It is done through several methods. That is, usually the balloon or a cylinder is put inside the esophagus, and gradually it makes the opening wider. But it is slow procedure, and it will take several settings. So it is an outdoor procedure basically. And generally once in a week, you are given dilatation or dilator by using this balloon or cylinder. And gradually the esophageal dilatation is done to achieve the desired girth of the esophagus. So it is a time-taking procedure. It may take several settings also, and it is useful in only in the simple stricture, which are more small, having smooth edges, and still allow you to take the solid food. So this several dilatations of in several weeks can be helpful to overcome the symptoms. And some complex strictures which may not be respond to this simple dilatation procedure, or may recur or may return again. In such cases, the other treatment options are necessary. And for the esophageal stricture which are not responding to the dilatation alone, the conventional therapy, your doctor may use the combination of several treatments, especially in the cancerous lesion. If you're having the stricture due to the cancer, the main aim or main focus of the treatment is to treat the cancer, because if we can control the main pathology, will limit the stricture formation and prevent the stricture progression as well. And your doctor may use local steroid injection into the stricture site to reduce the swelling of the stricture after the dilatation and prevent it from recurring after the dilatation. Another procedure is the endoscopic stricturoplasty, where the endoscope has been inserted and a special needle knife has been placed under the endoscope, and it is used to break up the scar tissue of your stricture. And here the small multiple cuts has been made through endoscope, and you will be giving relief for that. So it is also requiring several sessions. Another thing is the stenting. That is a small tube or small pipe has been placed into the esophagus, which keep it open after dilatation and to prevent the recurrence of this stricture again. And see, though this procedure is especially useful in the cancerous stricture, that has been not useful or not responding to simple dilatation procedure. And in some cases where the this stricture is not responding to this conventional treatment options, you may need surgery. Your doctor may operate part of the esophagus or maybe the whole of the esophagus, where as per your requirement, especially in the cancerous lesion, the part of the esophagus or maybe the whole of the esophagus has been operated or replaced for the relief of the patient. And if you have chronic reflux disease also, the chronic acid reflux, a minor surgery may be required for you, because thus if you are having loose lower esophageal sphincter stone, this is a sort of bending procedure to increase the tone of the lower esophageal sphincter to prevent the reflux. Or maybe if you are having hiatus hernia, the repair of the hernia to put the stomach inside below the diaphragm is required. A small operative procedure is required to give you the relief. So the esophageal stricture, it can be prevented in some cases also. So if you are feeling the problem of the dysphagia, especially the symptoms due to the narrowing of the food pipe, the esophagus, that is, you are having dysphagia or you are having chronic reflux diseases like heartburn or maybe chest pain, it is very much necessary to consult your doctor at the earliest opportunity, because these symptoms are not only bothersome, but they are pointing towards the inner pathology. That is, you are having real damage inside, and that will progress with time and you can have complications for that. So at the earliest opportunity, you should consult your doctor. And fortunately, if your symptoms or your esophageal stricture are detected at the correct time, and if your doctor can identify the basic cause of the stricture and start treatment at the right time, you will be getting relief from that and you can prevent the complications. So you do not hesitate to reach out to your doctor for the treatment of your esophageal stricture or symptoms of narrowing of the food pipe. So this is all from my side, and thank you very much for your patient hearing.